Good morning, everyone. I want to share a little experience that I had this morning and maybe a little bit of awareness. The whole concept of uncertainty is a lot of the perspective from which I teach. Uncertainty of which tissue we're impacting, if any. We know we're impacting a lot, including the nervous system, but can we really just touch that tissue and impact that fascia or the trigger point or the weakness or whatever that is? Anyway, I was playing a bit with some of the Mulligan techniques that I had learned from a study online and cervical work, where you just basically do a little bit of a stabilization of the transverse or the spinous process. I'm interpreting this on my own, not what Mulligan taught me, and allow the patient sort of an active engagement. I'm resisting downward posterior spinous process, and patient is actively moving forward. And it was really fascinating. It's kind of like a lot of different flashbacks came into me. As I was holding that engagement, I was looking at some of the things that I was taught over the years in terms of what to tell the patient to do, what to tell the patient in terms of how hard to push, how long to hold it for, and what should be going on. And I thought back to my MFR training and was taught that if I don't hold it for 90 to 120 seconds, that it's not effective because we're not engaging that fascial barrier. Although that story apparently changed to 5 minutes now, that you have to hold it a minimum of 5 minutes to make a true change in whatever properties that they're teaching these days about the fascial narrative. And then I look back even earlier when I was taking some zero balancing training, and they spoke words such as, you only hold a technique long enough until you, the therapist, senses the patient beginning to change. It was pretty subjective, but it was often only just a couple of seconds until the appreciation of something happening started. And then the directions were to get out of there, to let the patient do their own work. I was really contrasted and conflicted from that because, the MFR thing is you had to hold 90 to 120 seconds. The zero balancing was sometimes 2 seconds was enough. But the weirdness of all that is both of those interventions often were effective. And thus far, I've not seen a study that says, one intervention, one modality is more effective than anything else out there, or better than anything else when it comes to manual therapeutic intervention. What about pressures, right? You listen and you train with, for instance, the craniosacral paradigm, where they teach you 5 grams of pressure, at least in the beginning, is sufficient. That's all that's necessary. In fact, you'll often refuse to give a patient more because it's not necessary in order to introduce change. And then you tell a story as to why that 5 grams is enough. But then you go into deep tissue training, and unless you basically beat the crap out of your patient, although they don't term it like that, but basically use really aggressive pressures, you're not breaking things down. Now, look at the wide gulf between that craniosacral type of pressure and the deep tissue kind of pressure. How can both of those be working on a human being in front of us? Are they so different, or are there other factors at play? Is it more maybe the perspective of the patient that matters more? So let's roll back to that experience that I had with my patient this morning when I was working on the neck, and instead of telling him how long he had to hold that stretch or what kind of pressure was best for that stretch, what I did was I cued him into telling me what pressure feels good from me. And I'd like you to hold the stretch as long as it feels useful and effective, if indeed it does at all. And he certainly agreed that it felt really good. As I sort of stabilized in a downward direction and he pulled forward, he said that felt really good and really relevant. And instead of me telling him how long to hold it for, or instead of me telling him what kind of pressures were best, I flipped it around and I basically asked him, tell me what pressure you would like, and tell me how long you'd like to hold this stretch until fatigue or pain or boredom sets in and you want to release the pressure. And, I'm not saying that what I'm advocating here is necessarily a superior alternative to all those other paradigms. I'm just asking you, can all of those other stories be correct? Or maybe they're not. That's all I'm asking. That's all I'm saying. Uncertainty is what we do.